Welcome to your health talk. This week we thought of visiting Dr. Magdi from a Forest Park specialized hospital here in Lusaka, and we thought of handling a certain subject matter that we had handled, I think, about 2018, and it really concerns much about men's sexual lifestyle. This topic is erectile dysfunction. The first time when we handled this topic with Dr. Magdi, it raised quite a lot of questions. We had a lot of response from different people across the country, and a lot of questions came in terms of how erectile dysfunction comes about, and of course what's the best way to handle erectile dysfunction. And I thought for the year 2019, even as we begin a series of topics that are specialized, I thought erectile dysfunction could be the first that we can talk about today. All right, so for your questions, your contributions, and any other questions that you might have on this particular subject, make sure that you visit our Facebook page, QTV Zambia, or the number on your screen. You can simply send us a text on that one, and I'm sure that in the next episode, Dr. Magdi will be there to handle your questions and so on and so forth. Dr. Magdi, welcome to your health talk today. Thank you so much for giving us time.
Yes, thank you. Welcome.
Thank you so much.
Yes.
One of the common questions that we received the first time that we talked about this subject was just generally what erectile dysfunction is. Maybe we begin from there. What is erectile dysfunction?
Erectile dysfunction means the person has weakness in the erection of the penis. Mm-hmm. This is called erectile dysfunction, and he can't complete the sexual relationship. This is the simple definition of erectile dysfunction.
Is it a psychological problem, or it's a disease, if we're to put it that way?
No, it is a condition happen due to second to many diseases like diabetes mellitus, like hypertension, like also it is common also in old age. Mm-hmm. This is the main condition that erectile dysfunction you find it.
Okay.
Also psychological, but psychological, the main effect of psychological, it is not on the erection, the psychological effect on what's called some patient complaining from rapid ejaculation, okay, premature ejaculation. Okay. So even this takes small amount, and after ejaculation, the penis is become soft.
Okay. Hmm. You talked about early ejaculation. I'm sure that it's something that men usually experience. Now, early ejaculation, can it also be seen as a result of erectile dysfunction?
No, because in case of erectile dysfunction, there is no erection from the beginning. Okay. So there is no chance to start the sexual relation. But in case of premature ejaculation, this means that there is erection, and just we start the sexual intercourse, he found out he ejaculate and the penis become so soft, and he can't complete, and they help his other partners.
You talked about this condition being also very common when a man is aging. Is it a normal process? Is it a normal condition that affects every man who is perhaps above 50?
We can't generalize everything. We can't say everything is can happen by 100%. Okay, some people don't suffer from erectile dysfunction, but it is common in the age. And in old age, most of the chronic diseases start to come out, like hypertension, like diabetes, and all of this. Also, the old age suffering from weakness, not only on the private organs, in others organs. So this leads to the cause of erectile dysfunction.
How can this condition affect someone's psychologically?
Of course, make a big problem in the relationship, and of course it make big psychological problem to him, and this is also increase the problem when secondary to erectile dysfunction. If he's suffering from any psychological like depression, like unhappy due to this inability to complete the relationship, sexual relationship, also this is increase the erectile dysfunction. So he should look for the treatment of erectile dysfunction.
To everyone who is just joining us, we are here at Forest Park Specialized Hospital, and I'm talking to Dr. Magdi. The topic on your screen, that's the one we are discussing today due to popular demand. We covered this topic in 2018 with Dr. Magdi, but we had a lot of questions coming in, and we thought today we can as well discuss it so that those who missed out on that, on a few points, a few notes, maybe we can cover that today. If you've got any questions, please feel free to drop your text message using that number which is on your screen as well. Now, Dr. Magdi, erectile dysfunction, is it a genetic condition? Is it something that one can inherit?
No. It is not a congenital anomalies. This is, we see erectile dysfunction. This means he has already good sexual relation, he has good erection when he was young, and due to any other cause he had this dysfunction. But there is no any congenital, there is no any genetic for this disease.
What are some of the risk factors that might contribute to someone developing erectile dysfunction?
As I said, chronic diseases like diabetes, like hypertension, like HIV, this chronic condition lead to erectile dysfunction.
So
and also to complete, and when we start treatment of erectile dysfunction, we have to treat all this chronic condition. Because erection, like we can symbolize the erection like erectile circle. Erectile circle is switch and cables, and at the end of the cables there is a tube. If there is no power and the tube is brand new, it does not give you light. So we resemble this tube like the penis. This tube like the penis. If we do for the penis PRP and regenerated and rebuilding the tissue of responsible erectile erection, and this penis become very good and he can erect, but without management of the other part of the circle, like hormonal study to find out if there is deficiency in testosterone hormone, we have to check if there is diabetes mellitus or no, we have to check hypertension or no, we have to check also if there is any problem in the circle between, because erection start from the brain, from the pituitary gland, start send stimulation to the erectile tissue through the nerves. Even if the patient has diabetes mellitus affects the peripheral nerves. If the patient has hypertension, this hypertension affects the blood vessels, which is very important in the process of erection. So to manage all of this should be managed as a package. But for the erection itself, which is from the penis, we have the PRP, which is platelets rich plasma, which is regenerate and rebuild the tissue of the penis. Besides, we have to look after all this chronic disease, we have to manage it to get good result.
From your experience in dealing with this condition, how common is it here in Zambia among Zambian men?
I can't, because we started this PRP treatment just 1 year ago, but I can't put a percentage. It's so difficult. But also, this is one of the some men get shamed to complaining about it. For this, not all of the people who has this erectile dysfunction come to the doctors. Some of them try with this herbal drugs that is on the sell on the street, or some centers for herbal drugs, some drugs which is used in this condition like Viagra, whatever. And this is not give the treatment like PRP, because in case of exhaustion of the penis and the tissue of erection is very weak, even if the patient take all these drugs, there is no value, because the tissue itself is not working.
Can the erectile dysfunction, the ED, be prevented?
Prevented, you have to keep your health, avoid smoking, avoid the hypertension, avoid diabetes mellitus, avoid HIV. All this chronic condition, is you avoid it, also it should help you to avoid this erectile dysfunction.
All right, so you're still watching Your Health Talk, and of course, our topic of discussion is ED, that is erectile dysfunction. Dr. Magdi is my guest on the program today. We take a very short break. When we come back, we want to look at the diagnosis. We also want to look at treatment. Now, Dr. Magdi's presentation, I think, has made reference to the PRP, which also came out in the previous discussion that we had, and a lot of people had questions on the PRP and, of course, how effective it is in treating the ED, that is erectile dysfunction. But obviously, even before we even get to talk about the PRP, we might as well want to make reference to what he has just talked about. He also made reference of Viagra, and a lot of people today who are a bit shy to approach doctors on this particular subject have decided to go for Viagra and, of course, other herbs. I might as well want him to come in and just explain briefly how effective these are, if at all they are effective in managing and the treatment of erectile dysfunction. For now, we take a break. We'll be back shortly. All right, so welcome back, ladies and gentlemen. We are discussing erectile dysfunction on your the dysfunction on your program today, Your Health Talk, and of course, Dr. Magdi from Forest Park Specialized Hospital is my guest. In fact, we decided to walk through Forest Park Specialized Hospital, and we are right there at their premises here in Lusaka. Okay, so now, Dr. Magdi, let's now come to diagnosis. How is it done?
Diagnosis is just very, very easy, because this is complaint of the patient. The patient comes and complaining that is the erection is very weak, and sometimes it is no erection at all from the beginning. So he has problem in his sexual relationship. So the patient come and complain. So after he came and complain, we start to look for other chronic diseases.
Okay.
Like we make a hormonal assay to find out how is the testosterone level in his blood. We also find if HIV positive or negative, and if the patient is HIV positive and under treatment, nothing. It is very normal, like normal person. So also, if the patient with HIV has received his treatment, there is no effect. He look like normal person. Also, we check if the patient is diabetic or no, hypertensive or no, and we take attention to all of this chronic condition to manage it. After this, we do just general checkup like liver function, kidney function, complete blood pictures to see the general condition of the patient. After this, we start our safe treatment by PRP.
Okay. There's some patients who have realized that they have this particular condition and have decided to go for herbs, and others have decided to go for Viagra in trying to improve their erection. Is that effective?
To compare between PRP treatment and Viagra and other herbal drugs which help in erection, this is complete difference. Some Viagra and other herbal, just you push your tissue to work, and this tissue may be exhausted, and this tissue is not strong to help you. This is the value, and this is how this Viagra and other herbal condition work. It work by push this tissue to work. This is the action of Viagra. Also, this drugs has effect on, if the patient has cardiac attack, he can't use these drugs. Okay, he has problem to use this drug because as if it affect the blood vessels of the penis, it is also affect the coronary blood supply of the heart. So this is not used for anyone. These drugs has its side effect. If the patient use it from his own, don't under the observation of the doctors, it lead to a lot of side effect for the patient. But PRP, which is platelets-rich plasma, this is safe treatment, no side effect, no complication, no allergy. Reason why? Because we take blood from the patient and extract from this blood PRP and we re-inject it again in the penis. So from the patient to the patient under complete aseptic technique that we do here. So there is no any side effect, no any complication, no allergy, give good result, and this just once injection can work with you up to maximum 1.5 years. But you know other drug like Viagra, like herbal, you have to use it every time you want to go to sexual intercourse.
The PRP, you talked about it being quite effective. How long does that treatment take before somebody starts seeing the results?
No, the result is very fast. Just maybe after 1 week, 2 weeks, he can feel big difference.
Does it matter the age that you're dealing with?
No. The age is not effective. We did here last year for a person. His age was I remember 76 years old.
76.
Yes.
Okay. And so far, how's been the response from some of the patients you've dealt with?
Of course, the response when the patient young, like from above 40, 45, 50, the result, of course, will be much better than the patient over 70 years. You get me?
Mm-hmm.
So in case of young patients, the result will be very good.
You talked about some chronic diseases that might also facilitate for erectile dysfunction. So let me just, from the chronic diseases that you talked about, let me just pick up one, maybe HIV. Somebody is HIV positive and also has erectile dysfunction. How do you handle the treatment of erectile dysfunction when somebody is also on therapy?
It's very simple. Just we advise the patient to start to take the HIV treatment.
Mm-hmm.
And by following him by the investigation and found that has what's called Verona. There is no virus in his body. And at this point he like normal, but he should keep to take the treatment of HIV. And after this we manage him like a negative person. We do for him BRB and the result also is very good. Because you know why? The reason why PRP is the mechanism of action of PRP, which is not used only in erectile dysfunction, it is not used in other conditions, and we will talk about it again. That is, this platelets has growth factors. When we inject these platelets in the penis, growth factor release from the platelets. This growth factor initiate and regenerate and rebuild the tissue in the penis, which is responsible about erection. So the patient after injection of PRP, he got new tissue which is responsible about erection. So if we have this good tissue and we manage all other, as I said, the erection like erectile circle, we manage all the other parts like the general condition, like chronic condition. If we manage all of this together, the patient has new erectile tissue.
Another condition that I might actually pick up at this moment is somebody comes and you discover that they have diabetes. Which one are you going to start handling first between diabetes and erectile dysfunction?
All these chronic diseases that I have mentioned it, we have to start by it.
Okay.
Even when the patient came to me, I talked to him frankly and I explained to him everything. I said to him, if we do PRP now, and other condition, we don't look to this condition, there's no value of the PRP in your effect. Also, yes, it will work, it will regenerate the tissue, but as I said, if there is any problem in the erectile circle, the lamp will not give you light. So we have to manage all this chronic condition in the same time we manage the erectile dysfunction.
I've heard of some who have talked about surgery. I don't know whether with the coming in of PRP, I don't know whether surgery is also necessary if somebody is having erectile dysfunction condition.
No, PRP is not surgery. PRP is not surgery. I said to you, we take from the patient around 36 ml of blood, and this 36 ml of blood go through some processes, and we added some medical chemicals to this blood. We extract the platelets-rich plasma, and from every 36 ml of blood, we got 8 ml of PRP. We inject this 8 ml of PRP in the tissue of the penis, which is responsible about erection. And this gives result after 1 to 2 weeks. He found a very big difference. But as I said, we have to manage other previous chronic condition.
Okay. The reason why I brought in surgery is because some people feel the most effective way of handling erectile dysfunction is perhaps by surgery. So I don't know.
Yes. There is type of surgery which depend on we implant some material to make erection in the penis, but it not depend on the natural erectile tissue. He depend on a device, and this device implanted in the penis, and he used by different ways. Some used by inflation, some used by a lot of mechanisms. But all of this surgery depend on we have to implant a device in the penis to make like artificial erection, not natural erection, which he has got by PRP.
As you're dealing with a patient or a patient with this particular condition, are there some don'ts that are there some things that you usually tell your patients to avoid as they're also recovering from the treatment?
Of course, the patient should avoid this chronic condition, avoid diabetes, avoid hypertension, avoid HIV without treatment, avoid disuse. Some patient has going for sexual intercourse for long times, and this is like five times per day. Some patient said to me when he was in 15 years old, he make 5 rounds per night. All this is not unhealthy. So also the arrangement is very good in everything.
Dr. Magdi, this condition after a patient is treated using PRP, can it reoccur again?
Yes, I said this is treatment to give good result up to from 1.5 to 2 years by the same injection.
Okay.
Give good result.
Okay.
Okay, and after this 2 years, if the patient feels he come weak again, he can come for another injection.
Okay.
No problem.
Okay. Wow, interesting. All right, so those are some of the things that you need to know about erectile dysfunction and about the PRP treatment as well. Luckily enough, at the moment, this treatment is being offered here in Zambia, and Forest Park Specialized Hospital is one among the very, very few hospitals that are actually offering a PRP as well. But in most cases, well, there has been all these medications on the market, but well, make sure that you do that. But one particular problem that I've seen, I think especially with most men, is they are quite shy to come out when they have got this particular condition, but the information is that you need to come out. Now, I think Dr. Magdi, even as we come close to our program today, I think I need you to address that particular subject of most men feeling shy to come and disclose, especially to other health care providers, to say, I've got this problem. Many people think it's a personal problem, so why should I share it with these people?
No, this is like you have any problem in other part of your body. This is number one. And for PRP, we don't discover it. PRP is used all over the world. If anyone going through Google and he found that his PRP is used more than 30 years ago. But what we do now, just we bring all the facility that help us to introduce this service in Zambia. So now we have all the facility that help us to can do PRP in Zambia. So this is very safe, very simple. Just spend in the hospital 1.5 hours from A to Z. Plus we did all investigation. Even you can check up about your health condition. I think there's no shame. Everyone has this problem, should come to manage, because it solved a lot of problem to him.
All right, well, Dr. Magdi, thank you so much for allowing us to talk to you today on this particular subject.
Yes, thank you.
All right, so for all those text messages that are coming in, be sure that Dr. Magdi is going to come through in the next episode to come and answer some of those questions. And you can always keep your eye on the prize, okay? And yes, we can do that. So if you have this particular condition, make sure that you go for specialist treatment. Dr. Magdi is one of the few specialists that we have in Zambia who are capable of handling that condition, erectile dysfunction, and the PRP is in Zambia. Okay, so he's found at a Forest Park Specialized Hospital here in Lusaka. You can simply go there and ask for Dr. Magdi, and they will be able to direct you to him, and you'll be able to receive that treatment and be able to function once again. Thank you so much for watching. Thank you so much for your time. Make sure that you join us in the next episode.